1. In the context of NLN PAX preparation, which adult learning principle is best demonstrated when students use prior clinical experience to understand scientific passages? A. Motivation to learn. B. Experience as a learning resource. C. Task-centered learning. D. External reinforcement. 2. During curriculum planning for an NLN PAX review course, which step ensures the course aligns with both NLN standards and learner outcomes? A. Implementation scheduling. B. Needs assessment. C. Post-course evaluation. D. Instructor training. 3. An instructor evaluates students weekly to modify lessons for weak areas. This best illustrates A. Summative assessment. Formative evaluation. C. Norm-referenced assessment. D. Summarized testing. 4. A mentor helping NLN PAX candidates learn test-taking strategies focuses primarily on A. Developing independent analytical and reflective skills. B. Reviewing all answer keys. Memorizing vocabulary lists. D. Extending course length. 5. The principle of andragogy in NLN PAX preparation emphasizes that adult learners A. Depend on external direction. B. Learn best when content is immediately applicable. C. Prefer rigid, structured instruction. D. Learn through repetition only. 6. To ensure regulatory compliance in NLN PAX program development, training providers must A. Follow NLN testing standards and educational ethics. B. Create customized exams for each student. C. Eliminate grading policies. D. Publish student data publicly. 7. A student's improvement between diagnostic and final PAX practice exams reflects A. Evaluation validity. B. Knowledge transfer and learning progression. C. Constructive interference. D. Learning interference. 8. Which of the following most effectively promotes self-directed learning in NLN PAX preparation? A. Assigning guided study plans based on individual weaknesses. B. Providing identical schedules to all students. C. Using instructor-led lectures only. D. Focusing on group memorization. 9. A formative evaluation in NLN PAX training primarily aims to provide ongoing feedback to improve learning outcomes. B. Determine program accreditation. C. Rank learners based on scores. D. Identify final course grades. 10. The primary purpose of summative evaluation in an NLN PAX review course is to measure overall learning effectiveness at course completion. B. Collect informal feedback. C. Adjust lesson plans daily. D. Identify learner motivation. 11. An NLN PAX instructor ensures fairness in testing by A. Applying the same assessment criteria and timing for all learners. B. Adjusting questions for high achievers. C. Reusing private materials. D. Offering bonus points for attendance. 12. When mentoring students with different learning preferences, the instructor should A. Incorporate multimodal activities to reach visual, auditory, and kinesthetic learners. B. Use one standardized teaching method. C. Provide written feedback only. D. Focus on rote memorization. 13. A learner expresses anxiety about the science section of the PAX exam. The best mentoring response is to A. Offer reassurance and guided test practice to build confidence. B. Advise postponing the test. C. Focus on unrelated topics. D. Ignore the concern to maintain pace. 14. When designing an NLN PAX math review, including real-world nursing scenarios primarily supports A. Contextual learning and practical application. B. Abstract recall. C. Standardization. D. Passive memorization. 15. The most effective method for evaluating an NLN PAX course's success is A. Comparing students' pre- and post-test performance data. B. Surveying instructor satisfaction. C. Reviewing attendance records. D. Counting materials distributed. 16. An instructor's role in adult learning environments like NLN PAX Prep is to A. Facilitate learning through guidance and discussion. B. Deliver information without interaction. C. Focus solely on discipline enforcement. D. Provide all answers directly. 17. Using Bloom's taxonomy and NLN PAX curriculum development ensures A. Questions progress from recall to higher order thinking. B. Emphasis remains on memorization. C. Lessons avoid analytical components. D. All topics have equal difficulty. 18. In NLN PAX tutoring, the GROW model helps mentors A. Guide learners through goal setting and actionable strategies. B. Review theory without application. C. Assign tasks without reflection. D. Focus on immediate test results only. 19. Adult learners in NLN PAX programs are best motivated by A. Practical relevance of skills to nursing education. Competition with peers. C. Mandatory attendance. D. Extrinsic rewards only. 20. The reliability of an NLN PAX practice exam measures A. Consistency of results across test administrations. B. Learner engagement level. C. Time management skills. D. Question difficulty. 21. When designing instruction for the NLN PAX verbal section, a constructivist approach emphasizes A. Building new meaning through interaction and reflection. B. Memorizing vocabulary definitions. C. Repeating passages verbatim. D. Testing grammar rules only. 22. To comply with ethical standards, instructors in NLN PAX prep courses A. Maintain confidentiality of student data. B. Share scores with other institutions. C. Adjust results for underperformance. D. Use unauthorized materials. 23. A reflective journal assigned to PAX learners primarily supports A. Metacognitive awareness and self-assessment. B. Standardized testing performance. C. Data collection for instructors. D. Memorization techniques. 24. During course evaluation, collecting feedback from learners ensures A. Continuous improvement and curriculum relevance. B. Instructor accountability only. C. Compliance with marketing standards. D. Simplification of content. 25. When an NLN PAX instructor creates simulations for problem solving, they are applying A. Experiential learning. B. Rote learning. C. Verbal instruction. D. Abstract theorizing. 26. A student's ability to apply PAX reading strategies to complex medical texts demonstrates A. Transfer of learning. B. Fixed intelligence. C. Surface learning. D. Memorization. 27. An instructor ensures cultural inclusivity in PAX test prep by A. Incorporating examples that reflect diverse perspectives. B. Focusing only on Western contexts. C. Avoiding cultural discussion. D. Standardizing all examples. 28. A key component of mentorship in NLN PAX prep involves A. Supporting goal setting, feedback, and confidence building. B. Assigning repetitive drills. C. Avoiding one-on-one engagement. D. Enforcing strict autonomy. 29. The primary advantage of online NLN PAX learning modules is A. Flexibility for adult learners with varying schedules. B. Lack of instructor oversight. C. Reduced accountability. Unstructured pacing. 30. An instructor using open-ended questions in PAX discussions is fostering A. Critical thinking and analytical reasoning. B. Surface learning. C. Memorization recall. D. Directive instruction. 31. The alignment of course objectives with NLN PAX competencies ensures A. Validity and instructional effectiveness. Curriculum redundancy. C. Reduced accountability. D. Simplified teaching. 32. Which type of communication is essential to ensure clarity during NLN PAX instruction? A. Two-way, active listening and feedback exchange. B. One-way directive communication. C. Written-only interaction. D. Instructor-dominated lectures. 33. When evaluating the overall impact of PAX training on learners' nursing readiness, educators focus on A. Performance improvement and confidence in academic transition. B. Marketing success of the program. C. Number of lessons completed. D. Instructor workload. 34. In preparing candidates for the NLN PAX exam, which mentoring approach most effectively promotes critical thinking and self-assessment? A. Providing immediate answers to all practice questions. B. Encouraging reflective journaling on test strategies and reasoning. C. Limiting discussion to correct answers only. D. Using standardized answers without explanation. 35. When evaluating the effectiveness of an NLN PAX preparation curriculum, which metric best measures learner outcomes? A. Instructor satisfaction survey results. B. Average improvement in mock exam scores over time. C. Number of practice materials distributed. D. Attendance rate in review sessions. 36. During small group review sessions for NLN PAX verbal reasoning, what communication method fosters deeper comprehension? A. Reading passages silently without discussion. B. Facilitating Socratic questioning and group dialogue. C. Allowing only instructor explanations. D. Using time drills exclusively. 37. In the context of regulatory compliance for NLN PAX preparatory programs, which practice ensures adherence to institutional accreditation standards? A. Maintaining transparent records of instructional design and assessment methods. B. Allowing instructors to modify grading without documentation. C. Skipping data collection to reduce administrative load. D. Outsourcing testing materials without review.